With the outcome medical equipment, I've been able to treat patients that in the past I had very little effective therapy for.
My experience with Outcome Medical with the patients I've had that have gone through the program has been totally positive.
I never seen anything like it, and I am amazed at some of the outcomes that I've gotten that we just couldn't get with traditional pain management techniques.
The designers of this product basically looked at different disease processes and looked at what occurs when you change the frequency response from the equipment with that disease process. And then they designed a thing called a smart card, which makes it very easy for you to use this in the office. The smart card is basically just a little, looks like a credit card, and it has an embedded chip in the back of the smart card. Each disease process basically has a frequency response and a card associated excuse me, with that response. When you see the patient, we know the diagnosis. It's easy to look in the manuals and see which card is responsive to that diagnosis. The method that we would use to treat the patients is basically do our blocks as we would normally do without the steroid. And then as the patient goes to the recovery room, define the card that will be used by the technician in the machine for that diagnosis. By doing this technique and by using this approach, I found that it hasn't changed my input or my time input into the care of the patient. The clinic patients that I chose were end-stage patients. These are patients that had no other therapy that was appearing to work at the time. The patient I think I remembered most is a physician friend who had arachnoiditis. We treated this gentleman with the OML protocol, and within 3 weeks his arachnoiditis pain had decreased to the point that he could again travel on airplanes. Prior to that, he could not fly any distance due to the arachnoiditis pain from pelvis pain. And to him, this was a life-changing event. Because of this encounter, then I started attempting to use the OML equipment on other patients that were truly end-stage. The people I normally think of as end-stage are folks with one patient with multiple sclerosis that was truly end-stage. He couldn't use his hands. He couldn't, his hand, only function he had with his hand was the use to move his wheelchair, was the control on the wheelchair. Again, with the therapy, OML therapy, this gentleman, his pain is now resolved. His medicine usage has decreased 50%. And this is something I'm commonly seeing with the equipment, is a decrease in usage of narcotic particularly. And the decrease in drugs like Neurontin, anywhere from 30 to 50%. And the patients with that decrease in pain are then becoming functional. Now, my gentleman with multiple sclerosis, I'm sure you think, well, he's not functional, but I can tell you that he's happy with the response. He can get up during the day, his Neurontin dose is dropped in half so he can again think. So he is happy with his life at this stage. We've also treated diabetic neuropathy with good response. Again, decrease in drug dose, about 50% with the narcotics, and in some situations the Neurontin 30 to 50%.
I think that the total eradication of pain in these patients is believable when you take a very, very close look at how the local anesthetic and the electricity interact. The nerve is returned to its homeostatic state. In the depolarization block, all the sodium, potassium, calcium gates are open and the nerve is returning to normal. Normalization is functioning without pain. And this also very probably occurs in the secondary pain areas such as the dorsal horn and up into the thalamus and so forth, areas that we really haven't a clue what's going on, but exactly. All we can look at are the outcomes, which have been nothing short of spectacular.
I believe the technology associated with the electroceutical medicine that we've seen, particularly with the OML equipment, is the wave of the future for pain medicine. I think it will change the way we practice pain medicine in the future, and this will become an integral part of what we do in pain medicine. I am so impressed with the equipment that I agreed to come talk to you today so that other people could understand that this is a viable alternative for pain medicine therapy.